Good morning, everyone. Welcome to the Las Vegas Urban League WIC Culture Club. My name is Robina. I'm the program nutritionist at Las Vegas Urban League WIC.
And I'm Samaj Bruce, the IBCLC and breastfeeding coordinator for the Urban League WIC office.
Awesome. So today we'll be covering the topic of skin. What is the largest organ in the human body?
The skin. I watch lots of Grey's Anatomy.
I know you do. Okay, awesome. Samaj is right. Skin is the largest organ in the human body and serves several essential functions. It forms a protective barrier that shields the body from external environmental factors such as bacteria, viruses, and physical injuries. Skin also helps regulate body temperature, acts as a sensory organ, and plays a role in the synthesis of vitamin D when exposed to sunlight.
What are some of the functions of our skin?
Protection. Skin acts as a barrier against pathogens, UV radiation, and physical damage. Also, vitamin D synthesis. The skin produces vitamin D when exposed to sunlight, which is essential for bone health and immune function. Protecting your skin from the sun's harmful UV radiation is essential to preventing sunburn, premature aging, and reduce the risk of skin cancer. Here are some tips for effective skin protection from the sun. Alright, so number one is use sunscreen. Apply a broad spectrum sunscreen with an SPF of 30, which is sun protection factor, or higher to all exposed skin. Even on cloudy days, reapply every 2 hours or more frequently if swimming or sweating. Be thorough when applying sunscreen, ensuring you cover all exposed skin. Apply it at least 15 minutes before going outside to allow it to be absorbed properly. Don't forget to apply sunscreen to often missed areas like your ears, neck, and the tops of your feet. And number two, seek shade. Whenever possible, stay in the shade, especially during the sun's peak hours between 10 a.m. and 4 p.m. Shade provides excellent protection from UV radiation. Also, while doing all these things, wear protective clothing, covering up with long-sleeved shirts, long pants, and a wide-brim hat that covers, that shades your face, neck, and ears. Clothing with high UPF rating provides additional protection. Also, it's important to use sunglasses, sunglasses that are 100% blocking of UVA and UVB rays to protect your eyes and the sensitive skin around them. And avoid tanning beds. Artificial tanning devices such as tanning beds, can emit harmful UV radiation that increases your risk of skin cancer and premature aging. It is also to stay hydrated. Drink plenty of water to keep your skin hydrated, which can help reduce the risk of sunburn. Also, checking the UV index. Pay attention to the UV index in your area. This index indicates the strength of UV radiation and helps you plan outdoor activities accordingly. And try to be mindful of reflective surfaces such as sand, water, snow, and concrete that can reflect UV radiation, increasing your exposure. Take extra precautions when near the surfaces. Perform regular skin checks. Performing regular skin examination of your skin to check for any unusual moles or changes in existing moles. Early detection of skin cancer can be life-saving.
And how about diet and skin?
Alrighty, so a diet rich in healthy fats and vitamins can support skin health. So here are some foods that are great for our skin. So fatty fish, which is a source of omega-3 fatty acids, are necessary to help keep skin thick, supple, and moisturized. In fact, an omega-3 fatty acid deficiency can cause dry skin. Avocados. Avocados are high in healthy fats, which helps our skin be flexible and stay moisturized.
I love avocado.
Me too. Vitamin C. Vitamin C is also an antioxidant that helps protect your skin from oxidative damage caused by the sun and the environment, which can lead to signs of aging. A great source of vitamin C is bell peppers. It is also a source of beta carotene, both which are important antioxidants for your skin. Vitamin C is also necessary to create collagen, the structural protein that keeps your skin strong.
Nice.
Another source of beta carotene is sweet potatoes, which acts as a natural sunblock and may protect your skin from sun damage.
I love my sweet potato fries.
Me too. And other foods, just to throw in there, are broccoli, tomatoes, soy, and red grape are also great for our skin. Just a reminder that sun protection should be year-round habit and not just during the summer months. UV radiation can still harm your skin on cloudy or overcast days, and it can penetrate glass, so protection is needed even when you're indoors near windows. Taking these precautions will help keep your skin healthy and reduce the risk of sun-related skin damage and skin cancer.
Awesome. Sounds like skincare can be a form of self-care.
We love self-care.
That's great information about skin, Rowena. Thank you. Now, you know me. I have a lens of lactation as a lactation consultant, and I'll be sharing some information about how human milk can be beneficial on the skin for both mama and baby. Rowena, did you know human milk can be used as a topical aid on human skin?
Yes, only because you told me.
Awesome. Well, I'm glad you retained that information, girl. So, human milk contains healing factors that nourish the skin and actively repairs damage on irritated skin. It is used on infants for eczema, cradle cap, stuffy noses, and other skin irritations that could be present. Mom can also use it on her nipples to aid in healing from any damage that could be forming from still working on the establishment of an effective latch. I've even known families to use milk in an irritated eye or pink eye and feel relief and see improvement with improving results within a few hours just after application. So that's pretty cool.
Okay, nice. So for those who may not know, can you share what an antibody is?
Absolutely. So an antibody is defined as a blood protein produced in response to a counteracting a specific antigen. Antibodies combine chemically with substances which the body recognizes as an alien, such as bacteria, viruses, and foreign substances in the blood. So infants are vulnerable to the elements around them once they're born out of the sterile environment of the uterus. This is why the Academy of Pediatrics promotes human milk for infants up to the first 6 months of life. We support this and even encourage families to even try to extend, hopefully to at least a year or two. We understand the struggles of lactation and provide peer support right here in the clinics, virtually or in person. Human milk helps, and it helps the human body inside and out. So getting back to how human milk is beneficial in the skin, the antibodies in it help recognize a foreign entity and seeks to destroy it. It's the zinc and other healing factors in human milk that promote healing and reverse damage alone.
Oh wow, really? Zinc? How?
Yeah, yes, girl. So zinc is known to support. Zinc is a known factor that supports wound healing. With its antioxidant and anti-inflammatory properties, it enhances skin repair function and reduces redness and inflammation. It helps to relieve eczema, acne, rosacea, irritation, dermatitis, itchy, and dry skin. So guess what? Zinc is a normal component in human milk.
Nice.
Typically, a daily dose of 15 milligrams or less of oral zinc from prenatal vitamins or other multi-mineral supplements do not alter milk zinc levels in lactating women. Mothers may therefore take zinc supplements during lactation to achieve the recommended daily intake of 12 to 13 milligrams.
Nice.
Moms ask me all the time about what they can put on their nipples and to help the irritation or damage they are trying to manage on their nipples and areolas. And I always recommend human milk be at least one of the items used because there are a lot of products out there and people are trying things out, but people can always use their own milk. It's free and usually readily available, right? We like free, I like free. By the way, if anyone is dealing with sore, damaged, or irritated nipples from breast, chest, or body feeding, or from pumping, I highly recommend that you seek out a lactation consultant as soon as possible. If you are a participant of WIC, please contact your clinic and seek an appointed consult with a lactation consultant available to you. Even if your office doesn't have an IBCLC, the state has conveniently contracted IBCLCs for your clinic to arrange an appointment with you and your baby for you. So that's all we got for today. Please take time to follow us, like, and subscribe on all our social media channels, Facebook, Instagram, X, I guess formerly known as TikTok, or not TikTok, Twitter, excuse me, TikTok, and YouTube. Till next time, thank you for tuning in with the Las Vegas Urban League Wicks Culture Club podcast. Slap me some skin, Rowena.